So what the ischemia trial shows us, and this is a trial involving obstructive coronary artery disease patients only, ischemia assessed the role of optimal medical therapy in patients with stable angina who had obstructive coronary artery disease compared with revascularization. The study excluded patients whose symptoms occurred in the absence of obstructive coronary artery disease and did not look into the role of treatment of functional causes of angina like coronary artery spasm or microvascular angina. And this is important to remember. So basically, these were stable angina patients with moderate or severe ischemia who underwent blinded computerized angiography to identify the obstructive coronary artery disease. Those without obstructive coronary artery disease were eliminated from the study, and the rest were randomized to an invasive strategy plus OMT or to a conservative strategy. And the study ended up with approximately 2,500 patients in each of the arms. And in just one slide, I want to show you the primary outcome. There was no difference in primary outcome when optimal medical therapy, here on the blue line, and interventional therapy were compared. And this was over 4-5 years follow-up. So no difference in clinical outcome. And if we now look at other outcomes, looking, say, death from cardiovascular causes or myocardial infarction, no difference either. Death by any cause, no difference. Myocardial infarction, no difference. No statistical difference either. And if you look at the comparison of patients with diabetes, patients with different degrees of obstruction, you will see that except for a bit of angina, all the other variables do not, are touching the identity line or are on the identity line. So no difference between treatment with OMT or revascularization in the ischemia trial. So it is likely that some of the current recommendations of the guidelines will change in future guidelines. For example, this recommendation 1A for proximal LAD stenosis wouldn't make sense, or the presence of ischemia detected by functional tests or abnormal invasive flow reserve. So again, this will very likely be revised